Hi, my name is Sanjeev Bagga, and I will be sharing some of my thoughts during this time of COVID-19 about nature, science, and human diseases. I'm fascinated by nature, by birds, animals. The world is a beautiful place, and we, the humans, have to learn to coexist with nature. The economic activity has come to a standstill, almost a standstill. When will this be over? What is going to happen in the future? On 2nd May 2020, there were more than 3 million cases reported all over the world, with more than 22,000 deaths. A zoonosis is defined as a disease, an infectious disease that is naturally transmissible from animals to humans. The most recent viral infections are zoonosis, and they spread from animals to humans. The viral zoonoses include HIV, AIDS, influenza, severe acute respiratory syndrome or SARS, rabies, Ebola. The non-viral zoonoses include Lyme's disease, cat scratch fever, salmonella, and toxoplasmosis. Now, the current problem, the current outbreak of COVID 19 began in Wuhan, China. It is believed that it originated in bats, and the humans were infected at live animal market via the pangolin, which is a mammal and one of the endangered species in the world. So, from that point onwards, the infection spread from humans to humans. The incubation period of this disease is less than 14 days, and that is the justification of the reason why a 14-day quarantine period is insisted upon. Now, how does this disease get transmitted or spread? When touching a virus contaminated surface and then touching the eyes, nose or mouth, and possibly inhaling small airborne respiratory emissions containing the virus. Again, talking about the transmission, when somebody coughs or sneezes, that is how these infectious droplets are spread, and the chances of transmission decrease if people stay at least 2 meters apart. And the virus can spread during singing, intubation, use of nebulizers, and may linger on. Hence, it is important to avoid touching one's eyes, nose, and mouth with unwashed hands, washing hands often after with soap and water for at least 20 seconds, using alcohol-based hand sanitizer which contains at least 60% alcohol, and wherever these surfaces are frequently touched, such as doorknobs or bathroom fixtures, keyboards, elevator buttons, these should be cleaned using disposable wipes. This is an editorial that appeared in New England Journal of Medicine by Gandhi et al. And they point out that the virus shedding is from the upper respiratory tract, even amongst the pre-symptomatic patients. That is, the patients do not have any symptoms, yet they are shedding, or they are during their sneezing or coughing, these patients are shedding these viruses even though they have no symptoms. And as a result, there are high concentrations in the nasal cavity or nose of these patients or these asymptomatic humans, um, even before their symptoms develop. Now, according to uh, Lydia Buruba, a human sneeze can eject fluid and potentially infectious organisms, and the large droplets can rapidly settle down within 1 to 2 meters away from the person, whereas the smaller particles are trapped in the turbulent puff cloud and they remain suspended, and they can stay there for a few seconds or a few minutes and can even travel the dimensions of a room, which could be 6 to 8 meters away. So the problem is that there has been a rapid spread of COVID-19 across the globe, and the transmission is taking place from person to person. Problem is that the people who are spreading the disease have no symptoms, or most of them have no symptoms. So it becomes important that people take some precautions. And briefly, there are two types of masks, face masks, that are available. One is called a surgical and the other is N95. The surgical masks protect others by holding the respiratory secretions which result from coughing and sneezing, but they do not fit tightly, so the wearer can inhale infected respiratory secretions and emissions from the surroundings. Whereas the N95 masks, they fit tightly and hence they protect the wearers. In other words, the emissions or secretions that are in the air surrounding a person with an N95 mask, he or she is protected. Now, there are about 9 main symptoms that have been described for this particular disease, which is cough, shortness of breath or difficulty breathing, fever, chills, repeated shaking with chills, muscle pains, headaches, sore throat, and new loss of taste or smell. Now, when do we need to quarantine these patients? Those who are severely ill, they need to be isolated in a hospital. If they are not severely ill, they can be isolated at home. Healthy persons with no symptoms who have been in close contact with the COVID-19 infected patients are quarantined for 14 days after exposure. Now, I mentioned that, the rationale why 14 days. Now, it's the case fatality risk is about 1%. It has been found out that even young people are presenting with strokes in the brain. What is a stroke? Stroke is cessation of blood flow to a part of the brain, and as a result, that part of the brain undergoes infarction. Just like people have heart attacks, similarly people have brain attacks, which are called strokes, and normally this is unusual in a younger population. But with this particular disease, we've been finding a lot of patients who are young and are suffering from strokes. Now, what is the lab testing that is done in a hospitalized patient? Basically, a complete blood count, metabolic panel analysis. How does the diagnosis of this disease take place? Now, diagnosis is typically by reverse transcription polymerase chain reaction, and the swabs are taken from the nose, or what is called the nasopharyngeal swabs. And initially, the throat swab sample positive rate could be 30 to 60% at initial presentation. An interesting fact is that a CAT scan has a sensitivity of about 98% compared to the reverse transcription polymerase chain reaction, or RT-PCR, which has a sensitivity of 71%. Now, so we do use the polymerase chain reaction assay for the diagnosis of the viral disease, and we take swabs from the nasopharynx. Now, soon after the symptom onset, the sensitivity of PCR testing of nasopharyngeal swabs is very high, but false negatives do happen. So if a person is suspected to have this disease but has negative nasopharyngeal swab result, repeat testing should be done. And another thing that the FDA approves or finds it acceptable is that on-site self-collection of specimen from the anterior aspect or anterior part of the nose is an acceptable method of collection. Now, in terms of the diagnosis, chest x-rays are the initial imaging modality or method, and the American College of Radiology does not recommend CAT scan as a screening modality, and it should only be used according to the ACR in hospitalized patients or in special circumstances. Here I'm showing you two CAT scan images, and the white portion where the arrow is pointing in both these is what are called ground glass opacities, which is one of the features of this disease as seen on CAT scan. Normally the lungs should look all black except for the blood vessels, which you see as white structures, which are very white, such as these are the blood vessels which have a contrast within them, and that's the heart. And so these whitish things that you're seeing against the black background, these are what are called ground glass opacities, and this is what happens. This is one of the features of COVID-19 on a CAT scan. So what do we do for patients who have moderate illness? Well, we recommend hospitalization, and these patients may be short of breath, but the good news about them is that their blood oxygen saturation is at least 94% when they are breathing room air. Now, on the other hand, the severely ill patients obviously require hospitalization. Their respiratory rate is more than 30 breaths per minute, which is called as tachypnea, and their oxygen saturation is less than 93%. And on a CAT scan or an X-ray, there are what are called lung infiltrates, which involve more than 50% of the lung field involved, and I showed you a CAT scan. Now, as yet, there is no definite treatment. As yet, there is no definite treatment, and the FDA has given emergency approval for some of these medications. One of them is remdesivir. Another is malaria drug called hydroxychloroquine, and then obviously a few limited studies have been done and has not been found to be effective, and I'll be presenting a little more data on these medicines a little further. So we are currently treating this disease with what is called empirical therapy, which means that we are trying all kinds of medicines, and we have not conducted any control trials. As a result, the physicians all over the world don't know how to treat this disease, and they've been trying all types of diseases. So obviously, first thing that people do as physicians is to provide ventilatory support if somebody has a severe disease or severe interstitial pneumonia. Now, we have treated HIV/AIDS patients with this drug combination called lopanavir and ritonavir. So that has been tried. Chloroquine has been tried. High dose steroids have been tried, and then we have tried plasma from patients who have recovered from COVID-19, and the term used is convalescent plasma, and I'll explain this a little bit further. Now, so the antiviral drug combination of lopinavir and ritonavir has been found to be effective for HIV. A trial was conducted in China by Cao et al., and they tried this combination and they found that it wasn't very effective. No benefit was observed. So continuing further, remdesivir has activity against COVID-19. When I say activity against the COVID-19, I mean outside the human body, or as we call in vitro. So the trials as far as this particular medicine is concerned are not conclusive so far. One or two trials have shown that there has been improvement, and then others have shown that there was no improvement. Now, chloroquine and hydroxychloroquine, either without and with azithromycin, or what is called the Z-Pack, have been tried. And again, the malaria medicines, chloroquine and hydroxychloroquine, have been shown to be effective outside the human body against the virus. And then hydroxychloroquine also has anti-inflammatory effects and is used in rheumatoid arthritis. Unfortunately, the hydroxychloroquine and azithromycin, when combined together, and even hydroxychloroquine used separately, can have some effect on the heart, what is described as QTc prolongation. So there are some other things that the physicians have tried. One is steroids that we all know are used whenever there is an active inflammation that's going on. The other is what is called as convalescent plasma, and plasma is the liquid part of the blood from which the cells have been removed. And the good part about the plasma is that it has antibodies. So a person who suffered from COVID-19, recovered, obviously has developed antibodies against the virus, and they are present in this person's blood. So we take out the cells from the blood, and the liquid component of blood, which has antibodies, is then given to the people who are suffering from COVID-19 and are not responding to any other medication. But right now it is in an investigational stage. It has been found effective in some patients, but again, it has not been established as a definite treatment. Now, just a few facts related to what are the risk factors for developing complications of COVID-19. So, elderly people who are older than 65, who have heart disease, lung disease, high blood pressure, diabetes, who are obese, these people are at a high risk for developing complications. Well, another interesting fact that has emerged is that there are differences in infection rates in different parts of the world. Now, Iran has very high rates of infection and death rate, whereas Iraq, which is a neighboring country, has low rates of infection and death. Dominican Republic has very high rates, whereas Haiti has low rates. Indonesia had a very high death rate. Malaysia, which is a neighboring country, does not have that high rate. The large metropolitan cities of New York, Paris, and London have been badly affected, whereas Bangkok, Baghdad, New Delhi, and Lagos are relatively spared. These are also highly populated cities, particularly New Delhi. And what are the reasons for these differences? People have postulated some hypothesis. One is the fact that in India, BCG, or a vaccine against tuberculosis, is given to children. Then some people have thought or surmised that it is the young who have a better chance. But interestingly, Italy and Japan both have a higher proportion of older people in their population, yet Italy had a very high infection rate and death rate compared to Japan, which had low rates of death and infection. Now, another fact that has been pointed out is that the cultural practices of keeping distance um, in Thailand and India is one of the reasons for low rates of infection. What's going to happen in the future? I mean, things are going to change. There is no doubt about that. You will see canceled vacations, masks, sanitizers, more spacing, biometric screening while you're traveling by planes from one part of the country to the other or from one part of the world to the other. And obviously, privacy would no longer be the concern of all the governments, because they want to have control about who is going where and to be able to trace people and those who are infected. So where are we going, where are we reaching, and what is going to happen to us? So obviously the lockdowns that are continuing cannot last forever. So we will have to relax these current social distancing practices. The problem is that asymptomatic or people who have no symptoms could be shedding these viruses and infecting people. So we need to have extensive testing, particularly in certain settings like people who are in jails, in nursing homes, elderly people. And then general public needs to be observing certain practices. One of them is to wear face masks when they are in crowded outdoor or indoor spaces. The information that I have provided in this brief talk was obtained from the New England Journal of Medicine, the Merck Manual, and also from CDC and FDA websites.